Oh, you are? Okay. All right. We're live, so, we'll just sit here and I'll shoot them a message and see if anybody upstairs answers.
Okay.
Hi.
Mm-hmm.
What are you doing? What is it again? All right, nobody gave me any information that you were coming. Did you send it to Maya or talk to Maya? Yeah. Yeah, she's gotta put it on, she has to take the contracts and put them on. So I don't have anything, I can't Cox from her live.
I'll work it out for you.
Okay, I'm sorry.
That's all right.
I'll talk to Maya too after the meeting. We're live, just so you know.
Thank you. You celebrity, you.
Me,
Yeah.
I don't wanna talk about it.
Did you read it yet?
No.
It's very nice.
Oh, embarrassing.
She made the Web Weekly. Morning. Ask you to please rise for the prayer and the pledge of allegiance. Dear Heavenly Father, we thank you for this day. We thank you for guidance daily. When we're faced with challenges that are overwhelming, we pray your grace to carry us. Pray for a spirit of unity throughout our meetings in the community. May we be examples that please you. Guide our country over the next week as we vote for our leaders locally and nationally. May we respect others' opinions without retaliation and hatred. We thank you that we live in a country where we have the freedom to choose our leaders. May we do as your word instructs us to do, is to pray for them daily. These things we ask in your name. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. We'll convene the Commissioners' meeting at this time. Ask for approval of the minutes of the previous meeting.
I'll move to approve.
Second.
All in favor, say aye. Aye. Public comments on the agenda items only at this time. Okay, hearing none. We have bid openings.
Heather Lehman, for the kitchen hood fire system.
Good morning, Commissioners.
Good morning.
We only received one bid for this from Fry's Fire Systems. There is no bid bond for this.
It's weird.
And I'm just looking for the pricing.
Heather, why does it have two bids under two receipt numbers under the same bidder?
That was from whoever had put it in. They had accidentally added it twice.
Okay,
But we did only receive the one bid from them.
okay, thank you.
Yep. They are giving us a total estimate of the project cost at $54,265.
Wow. That is a real, that's an outrageous amount, is all I can say.
They have it broken out by the design of the kitchen hood as $1,180, and then the installation of the kitchen hood at $53,085.
What was the amount again? 54,000?
$54,265.
So the materials are how much? 1,000?
No.
No, the design of
The
the kitchen
design
hood
is how
is
much?
$1,180.
Okay, and the installation is 53,085.
Yeah.
It's amazing design.
All right, we'll have to send that over to maintenance and,
Just for the public, this is something that's required by law out at our pre-release facility, that they have a hood in the kitchen area where they're cooking, obviously for fire protection. Last thing we need is a fire out there with anyone. So this is something that's required by law, so.
Plus it has to meet the rigorous standards, and what is that, the NSFA or NSA?
but if I recall, I could have sworn we had prior estimates from companies to do this. And then,
We did, but then there was a additional requirement for fresh air exchange
Right.
system to be added to it.
right. And that's where I think we'll have to get together with the head of facilities, and then maybe even if we have to approach the the entity that regulates it, that would be the
Yeah. I mean,
Loyalsock Code Department.
It's the hood, a fire suppression system,
Yeah,
Mhm.
the exhaust fan.
Okay, thank you, Heather.
Hey, a shower glass door is $1,000. You know, it's crazy.
This is a 9-day project.
9 days to install
Yeah.
it? Yeah, it's not a small project.
Yeah, with the fresh air, they're gonna punch 2 holes in the roof.
yeah.
I mean, it's not just a single shoot, it's gonna be multiple.
Yeah, thank you.
And is the fresh air being required by the
Cuts.
codes?
Yes.
Okay.
Okay. Moving on.
Ready?
Yep.
So accounts payable cash requirements report, Heather Langman has that also.
This week's accounts payable check run on scheduled to be administered on Wednesday is for the amount of $1,576,509.17. Was there any questions with any of the invoices?
Is there any discussion or any questions? Okay, hearing none, can I have a motion to accept?
So moved.
I'll second.
All in favor, say aye.
Aye.
Aye, so carried. Thank you, Heather.
4.0 TDA actions with Lauren Bauer.
Right.
Yes, here.
Good morning, Commissioners.
Thank you.
We
Morning.
are seeking approval for a TDA change at Department of Public Safety, the Emergency Management Specialist Planning position. We're changing that from a pay grade 8-9 to a pay grade 7-8.
Okay, we have Mr. Hutchins here today. Would you like to make any comments on this?
Morning, Commissioners.
Morning.
Nothing too large. We had a staff member retire, and then just part of reorganization, just trying to bring the positions within EMA on an equal playing field. So it's just a realignment, capture some cost savings for the county.
Great. Do you have any idea what the cost savings would be, roughly,
I do
approximately?
not have, no, I do not have a
Put you on the
number, but
spot.
I will say, even though that position is 50% funded through PEMA under the Emergency Management Performance Grant.
Okay.
So,
But it is savings to the county, so we appreciate that. Thank you.
thank you.
Yep. Okay, I have a motion to accept the TDA action.
I'll move to accept.
A second.
All in favor, say aye.
Aye.
Aye, so carried.
And then personnel actions, Lauren has those also.
Okay, we are seeking approval for the following personnel actions. At the prison, Olivia K. Fisher, hiring as a full-time replacement bail release officer, a pay grade 8, $19.81 an hour, and that's effective November 9th of 2020. In adult probation, Carrie A. Bennett, full-time replacement. This is a promotion for her to a clerk 4, pay grade 5, $19.65 an hour, and this is effective November 1st, 2020. And then at the prison, Darren L. Thomas as a full-time replacement correctional officer, relief, pay grade CO1, $17.23 an hour, effective November 8th of 2020. And then again at the prison, Colin J. Grimm, full-time replacement correctional officer, relief, pay grade CO1, $17.23 an hour, effective November 8th, 2020.
Okay, so these are all replacement positions. 2 of them are at the prison. Well, actually 3. One's a bail release officer. The other one's at adult probation, where basically we had a clerk recently go over to the controller's office, and a clerk promoted within the probation office to take over her duties. So all replacement positions that are needed.
Yes, that's correct.
Okay, thank you. Any discussion or questions?
No.
A motion to accept?
So moved.
I'll second.
All in favor, say aye.
Aye.
Aye. So carried, thank you. We'll recess Commissioners' public meeting at this time and convene the salary board actions.
And Lauren Bauer has those also.
We are seeking approval for an update to the salary schedule. This is due to the change in the emergency management specialist position, the planning position. It's a pay grade 8-9 right now, but we're changing it to the pay grade 7-8.
Okay, any discussions on this? Hearing none, can I have a motion?
I make a motion to approve.
Thank you.
I'll second.
All in favor, say aye.
Aye.
Aye. So carried. And again, thank you, Hutch, for the savings to the county. And at this time, we'll adjourn the salary board actions and reconvene the Commissioners' public meeting. Thank you, Lauren.
Thank you.
So we have no informational items today. 8.0 action items, we'll start with 8.1, Lauren Bauer.
Good morning again.
Good morning.
So we are revising, it's County Policy 401, the county pay plan. And specifically what we have changed is the addition of some part-time language to bullet number 3 and bullet number 5. And then also, we are adding language for the corrective bargaining units in bullet number 6.
Okay. And we had previously had these issues brought to us at a HR meeting and are presented to the public today. And do we have any discussion or questions on these?
So, it says, when you say part-time individuals be entitled to a 1% increase to their base pay effective January 1st, 2020, you mean that each year thereafter in which full-timers get a part-time, or is it just the one time, the 1 year? The way it reads now, it reads to me as though part-time individuals be entitled to a 1% increase to their base pay effective January 1st, 2020, but January 1st, 2021 or January 1st, 2022 is not included.
Correct.
Okay.
Because
So-
that is subject to change. This policy is updated on a yearly basis.
On a yearly
Because
basis.
it depends on the cost of living
Mhm.
increase
Right.
that's established and, given to
Okay.
the employee.
I just wanted to clarify that. So this
Yeah.
is the one shot, and then if it were to be changed in the future, we'd have to redraft it.
Correct, yes.
Okay, thank
Yeah.
you.
Any other questions or discussion? Hearing none, could I have a motion to accept action item 8.1, revision to the county policy 401 county pay plan?
I'll move to approve.
I'll second the motion.
All in favor, say aye.
Aye.
Okay, thank you.
Thank you.
Thank you.
8.2, Wendy Hastings, voting on funding reduction change order to the Department of Health grant.
Good morning, Commissioners.
Morning, Wendy.
Back in August, the Department of Health advised all of the regional EMS councils in Pennsylvania that their budgets were being cut 11% effective immediately due to unforeseen shortfalls in the statewide emergency medical services operating fund. When we were presented with the new budget, which you have before you, they actually only cut 8.9%, taking us from our original budget of $271,515 to $245,160. While we'll still be able to fulfill the core obligations of our contract, the shortages will affect our ability to provide direct funding for special projects for our EMS providers and agencies in our 3 counties.
That's where the direct impact is, the special services, yep. Looking down through your chart, I noticed that. And I believe this is gonna be one of many state reductions coming forward over the next year, unfortunately. So, any questions or?
Yeah, what kind of projects do you think we'll be not being able to do?
So some of the projects that we've done in the past, we've sponsored training programs, we've done certified ambulance documentation specialist classes, advanced stroke life support, infection control officer training. We purchased carbon monoxide detectors for all of our ambulances and QRS units. We purchased bleeding control kits and provided training. We purchased glucometers for all of our ambulances to implement blood sugar monitoring at a BLS level. So those are all special projects that we're probably not going to be able to do. The one thing that we did keep in the budget, related specifically to our field providers, is to provide the reimbursement for the testing for the National Registry exam.
Yeah, it's good.
So is this the MSOF money?
Yes.
Yeah, that's what I thought. Okay, so in other words, they're holding back the MSOF money, but we're able to leave in the budget the reimbursement for our costs. That's great, for taking the test.
Correct.
Okay, good.
Okay.
Yeah, so the things you describe, I mean, we prefer to get the money, but the things you describe are things that it's not as though we're gonna, I don't want the public to think that the EMS services are gonna be at a inability to function as a result of the reduction. But if we did this year after year after year, and all the things you described we didn't do, we would be doing a disservice to the public. Well, not we, but the state would be, by not funding it, would be doing a disservice. Okay.
Any questions? Okay, can I have a motion to accept the reduction change, action item 8.2?
I'll second.
All in favor, say aye.
Aye.
Aye. So carried. Thank you, Wendy.
Thank you.
Jason, are you on the line?
Yes, ma'am.
Okay, Jason York says 8.3 and 8.4.
Good morning, Commissioners.
Morning.
Commissioners, for your approval today, 8.3 is the amendment to an agreement with Professional Petroleum. This just simply updates their labor rates for 2020. We used them just recently where they honored the 2019 rates, but said that the rates did change for 2020. And in front of you is the changes. General labor rates went up $2, overtime went up $3. Again, these are the professional service agreement on an as-needed basis. We don't use them a lot, but we do need them for our fuel services and our fuel islands that we have here at Spartanburg.
The trip charges are they, are any of them usually long-term, or are they mostly shorter-term trips?
Typically for us, they're the shorter term.
Okay, because I saw the different rates. Okay.
So those did not increase.
Yep. Okay, any questions on this action item? Have a motion to accept the agreement with Professional Petroleum.
I'll move to accept.
A second.
All in favor, say aye.
Aye.
Commissioner?
Yeah.
Okay. So carried. Thank you.
Thank you, Commissioners. Item 8.4 is an agreement with Verizon Connect NWF Incorporated for vehicle subscription services in the amount of $2,828.20 per month. Commissioners, this is a full-encompass GPS system with forward-facing and rear-facing cameras for our vehicles, which will include the transfer station, trucks, all recycling vehicles, a lot of the personal vehicles, small, actually trucks, and SUV that we drive around the site and onto customers' properties. We've had a need for this. If there's ever a dispute as to where our vehicles are located, if there was ever a traffic accident, this is definitely comes into play for protection of the employee and shows exactly what happens during a situation. It also gives us speed monitoring It also gives us engine diagnostics, where it'll download a code to us and tell us exactly if the truck's experiencing any issues. We do currently have a very limited and modified system on 10 of our vehicles. That support system has gone away. Verizon informed us that they will not be supporting that program any longer. And it was pretty much actually, I think we were paying like $19 a month for that system, where this is going to be about $44 a month per vehicle. And some of the vehicles aren't going to have the camera system or the tracking. So we do have status on our equipment that's going to be up to the working phase, so we'll be able to witness any issues up there as well. So in front of you is for $2,828.20 per month, which gives you an annual $33,938.40.
So Jason,
This will be able to be budgeted in RMS's yearly budget.
okay. So what is similar to what a police officer wears as a body cam to protect him in the municipality that he services? This is similar to where this protects the driver and the county for anything that would happen. It would be all documented. Is that a good analogy?
Yes.
Okay.
Well, and we've said this before, but this is, this and the prior contract are coming out of the revenues of the landfill, not from the property taxes. So you'll be paying for this with your revenues.
Mhm.
Do we get an insurance discount? Did you find that out?
No, sir, I've not been able to secure that answer yet. Because, and we are insured through the CCAP county policy, which is rather at a very discounted rate already. But I do not have an answer for you, sir.
Okay, any other questions?
Jason, how many vehicles is it on?
We are looking at 58 vehicles, and there will be 58 vehicles and equipment, and then 47 of them will have the video subscription.
Okay.
Oh, this is a tough one.
Can I have a motion to accept?
I'll move to approve.
I'll second.
All in favor, say aye.
Aye.
Aye. Commissioner? Okay, so carried. Thank you, Jason.
Thank you for your time today.
Thank you.
Eight 8.5 through 8.9 is Mark Egley. Do you just want to go down through them?
I certainly
Okay.
can.
We'll do them all together, Mark, or would you like to do them separately?
It's up to you. It's up to you,
We
Commissioner.
can do them all together.
Sure.
There's
I
no
can,
objection from the other two commissioners. Have we adopted as a whole? Commissioner Sarr? Okay, good morning, Mark.
Good morning. I have a number of odds and ends sort of contracts for your consideration today, and I'll go through each one of those. The first two are with Marikey. Marikey provides a variety of foster care and residential placement services for children in the dependent and delinquent system. There's two agreements. One is for last fiscal year, 1920, and the other is for the current fiscal year, 2021. You'll note that the daily rates, at the bottom rates are the same, the $29.29 a day rate did not change, but the maximum rate did increase. The reason that is because they added another type of service to their service array that includes care for mother and child, and mother and children. So this would be the case where a teen might be in our care that would also have a child. So they added some rates for mother and baby rates in the 2021 contract year. That goes to the $178.86. I'm pleased to report that we have no children in care that would fall into that category at this time, but it does happen. That would be the Marikey contracts. The next is our contract with STEP. STEP provides a number of services for both dependent and delinquent youth. And some prevention services for the community as well. The first is family navigation. We will refer some of our families to some of the services to gain access to help them navigate various human services that they would be eligible for and available through STEP and the rest of the community. That's at not to exceed $43,200. One of the programs that we're really excited about and pleased with has been the YES program, the Youth Workforce Development and Employment Program. That serves a number of kids both through referrals from our system and through juvenile probation and through some of the local school districts. And this is for youth who are at risk of dropping out of school or who have dropped out of school, and it helps them to obtain their either finish their high school diploma, get their GED, and then work on their skill development for employment or additional education. That has been a big help to us in terms of getting a number of our youth employment. So they serve about 35 kids on their caseload pretty much throughout the entire course of the year. So kids are coming in throughout the year, and then kids are moving on once they've accomplished their goals or gotten employment, those types of things. And that's not to exceed $205,000. And then the last is Stepping Stones. This is a new kind of initiative we just started last year, and it's really exposing, it's like a 10-week program that exposes our youth that are enrolled in the day treatment program to various careers and community service and things of that nature to help, I guess I want to say, to complement the education and the treatment that they're getting in our day treatment program. And we run that 2 times during the course of the year, so there'd be 2 10-week sessions of Stepping Stones offered at our day treatment program. The next contract is an agreement with West Branch Drug and Alcohol. This is they administer or provide the Strengthening Families program to the Williamsport, greater Williamsport area. It is a parent and child program where both parents and children attend. It's primarily for kids, for families who have children between the 10 and 14 age range. It's an evidence-based program, and it's really to help improve communication, school attendance, and develop some of the protective factors and address some of the risk factors that our youth experience. And West Branch administers that program for us in the schools, primarily the Williamsport Area School District. And the last is a renewal of a Human Services Development Fund agreement with Favors Forward, who provide some information referral services to the community, and that's a $3,000 annual contract with them. All of those contracts are, actually the STEP contract is about a $700 increase from last year overall. The West Branch contract is a $5,000 reduction. The Favors Forward contract is the same as last year. Any other questions?
No, Mark, I'd like to comment on action item 8.7. The YES program and the Stepping Stone program have been phenomenal programs, have really assisted a lot of youth.
Yeah.
And, you know, from the initial time when I saw YES come into the county to what it's grown into now is exciting.
Yeah, we would have gone from an original, like a one caseworker to do that, to now they have 2 full-time youth navigators that work with that population. And I think it's certainly a big asset for our community. Obviously, our youth struggle, some of our youth struggle with finding their way in that difficult time period of, you know, high school, finishing high school, and then what am I going to do with the rest of my life? And so this certainly helps provide some direction, at least in the short term.
And Commissioner Massar and I had the opportunity to hear one of the graduates next door in the courtroom. He stopped in to talk to us over at one meeting we attended, and to hear what's going on positively in his life and how this program really assisted him in a great deal.
Wonderful.
Yeah.
Well, I'm glad that you folks support it.
Yeah.
And again, remember these, the evidence-based programs are getting the 95% state match. The STEP one is still getting 80% state support. So.
And again, I want to thank you for the way you leverage dollars. You leverage the state dollars to alleviate the burden on the county. They're all tax dollars, but you utilize the state dollars much more effectively to keep the low matching dollars at a minimum. So we thank you for your assistance in that.
Yep, you're most welcome. Believe me, it's not me, it's the people that work for us, actually, that really look out to maximize the federal and state dollars.
Yes.
Yep.
Any questions?
You know, in general, what do you think the total budget is of children and youth and MHID?
I know children and youth, if you're just looking at child welfare, it's around 11 million a year.
11 million.
MHID is probably another, well, if you just look at, remember, they do a lot of billing through medical assistance for the services that are provided, so if you exclude some of that, they're probably around 8 million.
Yeah.
So it's $20 million for children, youth, and MHID.
And that's Lycoming County.
That would be like coming, yeah.
Right.
Yeah.
Okay. Very good. You do a great job, Mark.
Thank you, appreciate it.
Do you know what it is nationally, Mark, off the top of your head?
The what, how much money we spend?
Yeah.
Oh, goodness. The state, the child welfare budget at the state level is over $1 billion
Yeah.
at the state level. So, I mean, when Philadelphia's receives a couple $100 million in state funding plus, so, yeah. It's
very high.
the line item for child welfare in the state budget's over $1 billion. So there's a lot of money spent on, obviously, protection of children.
Thank you.
Thank you, Mark. I have a motion to accept action item 8.5 through action items 8.9.
I'll move to approve.
I'll second the motion.
All in favor, say aye.
Aye.
Aye. Commissioner?
Aye.
Okay.
Aye,
Aye.
Thanks very much, Commissioner.
Thank you.
Appreciate it.
Thank you.
Commissioner comment?
Do you gentlemen have anything?
I did, and I'm gonna ask the solicitor. Had a constituent call me up and asked if he could change his vote, a mail-in ballot. Can they do that in Pennsylvania?
I think that's allowed in Pennsylvania.
That's allowed in Pennsylvania.
It's not allowed in all states, but I think in Pennsylvania it is.
Okay. All right.
Anything else?
No.
Commissioner?
No.
I have two things. Last night we spoke to the public about the budget, and we'll continue to work on the budget through the final budget process, and looking for ways we can reduce cost. As Commissioner Massar said last night, it's a living document. It's something we're constantly working on, so we'll be diligently working on that. One thing I'd also like to address is there was an article it's in this week's Web Weekly, and I'll just read you the last line of it, or last paragraph of it. It's written about some negatives and some positives that are going on through COVID. And it says, but to end on a positive note, there's been a happy surprise through these COVID chronicles, and that's been the response shown by the Lycoming County Commissioners. This was written by Larry Stout. He's attended several hundred county commissioner meetings, and he can attest that they can erupt into some very sharp disagreements over a variety of issues. But in arguably the biggest crisis that's come along in decades, the three commissioners have cooperated admirably and shown real leadership in meeting these difficulties with courage and measured wisdom. What has been very inspiring is that all three men have recognized there is more hurt in the county than available help. Yet rather than throwing up their hands, they have developed creative solutions and worked with various agencies, which has done a lot to relieve some of that some of that pain resourcefully. So I don't want to say that I'm proud of this. I want to say I'm pleased with this, because when you say proud and pride, you get yourself in trouble a lot of times when you talk about pride. I'm pleased with this. I'm pleased to work with the two commissioners to keep things open. We have shown leadership in that aspect. It hasn't been easy, but through the creative measures by our departments, and I can cite you, for instance, adult probation, they didn't throw up their arms and say, what are we going to do? They went out and saw their clients in the field. They reinvented what they were doing. They went out and they've increased their contacts fourfold. They went from 1,000 contacts to 4,000 contacts. That's just one example of what goes on in the county, the creative ways that we're getting the job done. Taxpayers who pay a lot of money don't want to see services shut down and people hiding in their homes. This is a serious virus out there, but we can do this and we can manage it accordingly and we can function. And the county, through the employees and the leaders, have shown that we can get this done. We were shut down for a short period of time. A lot of those people worked from home, but we're back pretty much operate 95%. And when you see the state is still shut down, you know, they're working from home for 9 months because a few of their leaders aren't thinking outside the box. They aren't being creative. They're not showing true leadership by saying, let's get this thing done. Let's get these projects done. So that's what I'm most pleased with, is we're not throwing up our arms and saying we're surrendering to the virus. We're working with other agencies, we're working with the departments, and working amongst us. We've had a very low infection rate amongst county employees. I believe we're maybe 8, last I checked. And none of those individuals contracted the virus here in any of the county buildings. And I want to compliment our maintenance department. They're constantly going around to make sure that things are sprayed down, the public's protected, everybody's protected. And so we come to work safely and do our job, because one thing about the county is we have a very strong workforce that enjoys doing what they do. That's why we have such a long longevity in the county, is because people really enjoy coming to work every day and doing something that makes a difference in our community. And so I want to again thank Mr. Stout for this article. Again, it's very humbling, and I'm pleased to work with leaders, and we have a lot of work on our platform for the next couple of years. We have a lot of challenges, and we'll take them on one by one, head on. But I can guarantee the public we will get things done. We've got things done this year, and we'll continue to get things done.
Chairman, if I can add one thing. We noticed, what was the hospitalization rate today?
Locally,
Yes,
it was, the most current number is 12, I'll update at noon.
it's 12.
12, yes.
So yesterday we contacted Steve Johnson in UPMC, and we asked him about availability of beds in their system, and he said they had 50 beds, okay, which now you're saying there's 12. So we asked him, you know, when do you think it's really critical as far as public service announcements, you know, tightening up the ship? Because listen, if there's one thing we don't want to do going into the flu season, because you're going to have beds and they're not going to be sure, okay? And having our county shut down again. So, you know, whether you believe in the mask or you don't believe in the mask, I mean, the simple logic is wear them when we see that hospitalization rate is up, okay? And I don't think it's critical right now, but nonetheless, you know, I wouldn't want to see it go into the 20s and 30s, okay? Ventilators, anybody on ventilators?
0.
Yesterday was no.
Okay, as of yesterday. So, you know, although we're seeing an increase in cases, a huge uptick in cases, which I'm not concerned about, but I am concerned about the hospitalizations. And that's something that the public needs to be aware of. So we'll keep the public updated on this, but for right now, you got to think about this flu season and the beds that are available. So, tighten it up just a little bit, and we'll get through it. But we don't want to have to get closed down again. That's for sure.
Commissioner, I'll add to that the state hospitalization rate right now is 0.056, which is even close to what it was in the spring. And deaths are way down. So our hospitalizations, even though the cases are increasing because of testing, we have a lot of testing going on. It's amazing how much testing is going on. The cases are going up, but the hospitalizations are low and deaths are down. I believe since September, we've had just over 900, beginning of September, we had just over 900 deaths statewide. And 484 of those were in facilities, nursing facilities. So roughly 420, 430 people in the community over the two months have passed away statewide. And again, we don't know how many of those had comorbidities, had other health issues. There's no way of knowing that. Again, be diligent, be protective. I saw today that 92% of Americans are wearing masks. The mask is not the cure-all. It's a tool. It's just a tool to help prevent this. And for anyone to say that they're going to cure COVID and they're going to get rid of it is absolutely false statement. They're not God. They can't get rid of it. We have to manage this. We have to find a vaccine for it, which may take years. Who knows? But we have to do so cautiously and just respect each other at the same time. Watch out for those that are elderly and have health issues.
I think that, wait, by the way, a couple things I want to just comment on. You mentioned the budget. A constituent after the meeting said to me they had had difficulty getting in on the Zoom. They couldn't get in on the Zoom last night. I don't know why, but the public should know that, there's an opportunity to talk to us about the budget. You can either call us directly, 320-2124, if you want to talk to any of the commissioners. So it's not a done deal. The other thing, I personally, and I'm sure my colleagues would agree, we have to see what happens with the state budget, which hopefully, is going to be done by November 30th, the last day of the session, because we saw one cut here of about 9%, and if that continues, we might have to do something. We'll see. I think on the issue of the masks, unfortunately, I think there's been like mixed messages given to the public, and so, especially with public health crises, it's very hard when people get mixed messages about things. Imagine if you said to your child, well, drugs are okay sometimes. Sometimes you can, use certain drugs. I'm not talking about prescription drugs to get you well. I'm talking about drugs that people use, right? When you give a mixed message, people act in a manner that's sometimes consistent and sometimes not. I think we have to unequivocally say, the three of us, people have to wear masks. And scientifically, we can eliminate the virus if we eliminate all the hosts, because the virus is not a living organism. It's dependent on having a host to stay functional. We are the hosts. So to the extent that we can stop the host, stop from being a host, we can. And I think we just have to try, because I still go out to stores and I see people wearing masks, not wearing masks. And one constituent texted me and said, that I think Montgomery County has instituted, and Hutch, you can help me with this if it's correct, or maybe you may or don't know about it, where the county government has said, look, you have to wear a mask. If you're caught without a mask, it's a warning the first time. The second time, there's a $15 fine.
I haven't heard that.
Is that in Montgomery County?
I personally did not hear that.
Yeah, I don't even know whether the county has the authority to do that.
I'd be surprised.
Yeah, I doubt it. So for the public to understand, having something like that, you have to have an enforcement mechanism, and we don't necessarily have a tool that would enforce that, right? Because we don't,
We don't have a department.
You don't have.
right. We don't have a Department of Health, that's right. That's the difference between us and a Montgomery County. That's a good point, Director. But here's my point. We don't need to get into all that. If we just can get people to say, I'm doing it for the greater good. I'm doing it because it's my contribution. I'm reading a little bit of history now, and I'm just reading back to World War II and so forth, and just all the things people have sacrificed over the years. Asking us to wear a mask is really not a big deal. Is it a pain in the neck? Yeah. But, I mean, think about what our parents and our grandparents gave up to keep us alive. I just think that we need to do that. And the three of us need to unequivocally say to the public, listen, public, regardless of political persuasion, regardless of philosophical perspective, wear a mask. Because it will stop the spread of we won't be the host.
And it's unfortunate it has turned into a political issue. But we can't give like I said, 92% of Americans are wearing masks. Yet the numbers are going up. We can't give the public a false impression by wearing the mask that this is going to go completely away. That's not true. I've talked to people, and I've heard of people. There was a famous football coach who just contracted it. He wore the mask all the time. He preached to his players, be safe. He was asymptomatic. He tested positive. People test positive for this, even if they're wearing a mask. It's a tool. It's not a cure-all. So we can't get that false impression that if everyone wears a mask, it's going to eliminate it. It can help reduce it, but it's not going to eliminate it. And I believe most people are wearing masks either all the time or when they need to, in the situations that they desire to wear the mask. So again, there's nothing wrong with wearing a mask. We encourage people to wear the wet mask, but we can't get that false impression. Just like lockdowns. Lockdowns, the CDC has now said they did not work. They made the virus worse. They made it worse, and we see that across Europe. We see it across the world. The countries that had vast lockdowns, their cases are exploding, and that's not anything that's going to help reduce this by having lockdowns. They say follow the scientists, follow the experts. Well, the experts are saying lockdowns were detrimental, and it's going to continue to be detrimental if we go back to that type of pattern. So again, we have to learn how to live with this and do so responsibly.
And to get off the subject, Matt had to respond to a fire alarm over at 3rd Street Plaza. And lo and behold, imagine this. If that's where our voting equipment's at. That's where all the ballots are at. And I don't believe they're stored in any kind of fireproof or waterproof facility. And what a nightmare that would have been if there was a fire. That's another thing that we're going to have to look at after this election. Mm-hmm. But it's a serious issue, especially there's 6 floors, and you have water. It comes down. We're going to have to look at how we're going to protect those.
Water damage,
fire and water.
A lot of damage too.
Yeah.
Okay, any public comment at this time?
You have one on YouTube that
Oh, yes.
says, "Thank you, commissioners, for not raising our taxes during these challenging times."
You're very welcome. It's not an option. People are really struggling, and we see it. And we don't want to ever raise taxes, but this year especially is not the time ever.
Yeah, we'll talk about fair funding when it comes out.
Yep, the fair funding, we're going to talk about that soon, moving forward with the nonprofits. And there's no meetings next week because we have elections going on. So, yes, Matt.
Commissioners, just an update. As we're working on Project Digger,
Mm-hmm.
we're applying for different grants for assistance with some of the infrastructure. And I'm wondering, based on the timing of this requirement, the gas pipeline we need to put in for a grant request, which would require a resolution. And so I'm wondering if it would be appropriate, or you'd be willing to approve a resolution pending the legal language being worked out for the grant, which could give us 50% of the estimated $400,000 cost of the.
Is there a timeline on the grant?
We need to get it in ASAP.
So you simply need us to do a verbal approval of a resolution, which is basically giving authority to the planning department to submit the application for the grant, so that we can expedite the process of getting the money. Well, I'll move to put forth the resolution contingent upon legal review of the acceptance of the application for the grant.
I'll second.
All in favor, say aye.
Aye.
And just to address that, we have a developer who is, we're about 95% done, to bring manufacturing jobs to the land across from the landfill. I believe it's 145 jobs, Matt, was initially?
Right.
145 jobs initially, manufacturing jobs. That would pay the average medium of $45,000 per year to those employees. So we're very excited about this, and we're very close to that deal being done. And we look forward to hopefully announcing it within the next month. So that would be the land across from the landfill, the old farm. We have two developers that are very interested in that property. This one is just about done, so.
So the purpose of the resolution is to help us get money so that the county doesn't have to pay the entire cost of bringing gas to the land across from the landfill. And there's state grants available that will help us pay 50% of that cost.
Yeah.
So thanks for bringing that to our attention,
Yeah,
because
thank
we
you.
don't have that meeting next week.
Glad we got the email before we got done here.
Yeah.
Good to have your phone.
Yeah.
Technology, yeah.
Yeah, well, thanks for monitoring your
Yeah.
phone too,
Thank you.
Director.
And it's good to have the solicitor right there to assist us. Okay, so our next meeting will be
November 10th.
Tuesday, November 10th, here in the Commissioners Boardroom at 10 a.m.
Good to
And
have our
please,
meeting here.
please get out and vote. If you haven't done so by mail, please get out and vote. And exercise your constitutional right. Thank you and have a good day.
Don't forget, birthday luncheons at
Yeah,
noon.
that's today.
Oh, yeah, 12 o'clock. Is it 12 o'clock or what?
12.
Oh, but now it's 11.
It's 11 right now.
It's, yeah.
Yeah, it's 12 o'clock somewhere, but not here.
That's for sure. Oh, okay.
Don't worry.
Goodbye, Mr. Smith.
Yeah.
12 o'clock.
Thank you.
Thank you. Have a good day. Thanks.
Here, Eileen.
That was the,
Sure was nice seeing you today.
Hey, she's a celebrity. She's in the Web Weekly. They did a nice article on her.
I thought it was gonna be.
They have her picture in there. Yeah.